In outpatient, I'm collaborating. This is going to sound silly. Most in depth with the EMR system.
It
like
doesn't
I
sound silly at all.
I am digging through that EMR system with a fine tooth comb to find any and all resources that are in there for their history. What other specialists they've seen that could give me information and insight on how to treat this patient. If I can't find it there, then I'm calling doctors' offices and asking for them to fax that material over. Um, if they're also being treated by PT and OT, I'm going and I'm talking to them. Especially sometimes it works out where they get in to see PT and OT before me. So they've already done the evaluation and started working with the patient and have met them. And I go and I talk to them about what they see. And I say, okay, I have an order for XYZ. Have you seen any of that or had any difficulty with, if it's communication or if it's cognition or whatever? And then I ask them about that, and they have fantastic insights. They're one of my best resources as well. So, um, whoever sent the order over, that's their referring physician, and that could be anybody with a degree. It seems like. So what I mean by that is the primary care physician, or it could be one of the specialists. So it could be coming from a neurologist, a pulmonologist, the ENT, GI. Those are the ones I see the most come across. Sometimes, though, I get an order from their primary care. Oh, sorry, also the physical medicine and rehab doc. I get a lot of those as well because we have an inpatient rehab unit associated with our hospital. So I see a lot of those follow ups. Um, if it's coming from the primary care physician, sometimes I have to do a lot more digging and calling up the other specialists to get their notes if they're not part of our system. So then they wouldn't be in my EMR, and I have to call them directly and have that information faxed. And if I'm really lucky, I actually get to catch that doctor on the phone and ask them, which can be good or bad because these doctors, they see so many people. They like you have to have their chart up and be able to give them a pretty thorough quick history so that they can think of who that is or give them time to pull up their own documentation. Um, so yeah,
Well,
did
and I
that
think
answer that question?
I think you touch on something that's so important for all of us to remember, and even our new grads, is I couldn't agree more that having a village of other professionals around, I learn the most from my colleagues. But what you said about remembering that reaching out to those colleagues that aren't other SLPs, the PTs, the OTs, the dietitians, I agree wholeheartedly that I have learned so much from them, even sometimes more than my SLP colleagues, about what I need to do with a patient based on what is going on, because it's the whole body. It's not just, well, it's just, I'm in my speech box, you're in your PT box, you're in your OT box. It's really looking at the patient as a whole. And so
Mhm.
I think just remembering, and for ourselves, and reminding our listeners that utilize those other professionals and team members and the physicians, and remembering that if we all the more information we have, the better we can treat them, and we're not going to have all the information, so
Mhm.
it's so valuable.
Yeah. I can give an example of a patient that I've worked with recently that kind of can illustrate sort of the bobbing and weaving I've had to do with collaborating with other professionals in this patient's plan of care. So they were referred for dysphagia therapy after an ACDF surgery. So that's anterior cervical disc fusion. And there was a hiccup during that surgery where there was an esophageal puncture. So an ENT surgeon went in to repair it and then actually had to go back in and repair the repair. So he had three surgeries in the span of probably like 36 hours. And that was earlier this year. Due to those surgeries, he had a peg tube placed. And that's where he was getting his nutrition and hydration. So he was in PO. He had not been eating or drinking since earlier this year. And I'm seeing him in the late fall. He worked extensively with other SLPs at different points of care and was transitioning from home health to see me in outpatient. And he'd had a couple video swallow studies during that time period. And so I was using the information from those video swallow studies and the home health notes to progress this patient. His primary care referred him, but I had to reach out to that ENT surgeon to get the surgery notes and the follow-up notes to see how he was doing. And one of the video swallow studies recommended doing vital stem therapy with this patient. Well, we need that in an order before we use it in a session. So I got in touch with a primary care, the referring physician, to send over another order that just allows me to do that. And we had some back and forth, like phone tag. And one of the messages came back like, oh, they want the ENT to do it. And I'm like, the ENT doesn't do vital stem. Like, we got our wires crossed. What the doctor preferred, because the doctor wasn't familiar enough with vital stem and with the surgeries and the rehab that the patient was going through, to put that on an order, the physician wanted the ENT surgeon to approve the use of that modality. So I was like, oh, okay. And so that was when I actually got the chance to talk with that ENT. And he was like, oh, yeah, sure, I'll put that order in, no problem. And then, like, we talked about the patient a little bit. So, as the patient's progressing through their therapy, they're ready to reduce the amount of bolus feeds because now he's taking in more oral food and drink. Um, so then I needed to get the phone number for this patient's dietitian. And so I'm on the phone talking to the dietitian, and the dietitian is giving me information about, like, oh, okay, based on XYZ weight, I think they can go from this number of bolus feeds a day down to this number. And, just be sure to follow up with the patient. I'm like, definitely, all this stuff. And it's just so great. Like, all this collaboration with so many different pieces of this patient's care. And it's so important to have that time to make those phone calls and to do that. And I understand that we don't always get that luxury during the day, but this patient is getting, like, the best plan of care expeditiously. Like, this could take longer if we weren't all in communication.